Hello everyone, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Tannersville location, Stroudsburg Eye Specialists, located on Route 611 in beautiful Tannersville in the Poconos, Pennsylvania. Our phone number here, 570-421-3342. If you have any questions, comments, ideas for any shows, anything you want us to discuss, give us a call. If you're watching from our Hazleton area, Hazleton Eye Specialists, 570-453-2020. We're located on the Airport Beltway in Hazleton. Remember our website address, www.drkislan.com, so you can catch us anytime on the web. And now everyone has their smartphone, so you can actually download an app, SSP TV app, which has all of our shows on there. There's all those other shows on there too, but you don't want to watch that Sam Lassance show and all that other stuff. Make sure you tune into Eyecare Today. It's the best show on that app. So download the app and you can catch anything we talk about, any of the conditions, macular degeneration, glaucoma. We had a patient on with melanoma, patient complaining of headaches that we were able to figure out what was going on with her. So make sure to watch our shows, very educational. Today I'm joined by a longtime patient and friend of mine, Jack. Thanks for joining me today and taking time out of your day to come and tell your story to the folks out there. Jack, you've been my patient for about 6 years now. We were just discussing before we started, and you've been through a lot as far as your eyes go.
A good amount.
Yeah. So what we wanted to do today was just kind of tell the folks out there a little bit about your story. The good, the bad, kind of where you've been with your eyes. So talk a little bit about your history and kind of condition and things like that, if you don't mind.
Okay. I was diagnosed with type 1 diabetes in 1968. Ironically, on October 31st, which was Halloween, and that's a whole different story in itself. But I've been through some long battles. My biggest battle has been with the eyes. It's actually been my scariest battle. But there's been a lot of things along the way. I was not a good diabetic when I was young, but things have changed to hopefully maintain what I have ongoing now. But in 1982, or somewhere around there, I was diagnosed with diabetic retinopathy. Went through a lot of surgeries. I want to say it was somewhere around 17 laser surgeries, which were new at the time. I've been through 2 vitrectomies, a retina freeze, so I have a little history going on with that. Had some great doctors back then.
And let me jump in, you're how old?
I'm
now?
56.
56. So you were how old when you were diagnosed?
I was 6 years old.
6 years old when you were diagnosed with diabetes.
And that was all new at that point. I mean, it really wasn't a known like it is now. So
for the folks out there watching, a little bit about diabetes. So diabetes, especially in a 6-year-old, is a condition that affects a lot of these small vessels in the body. And of course, the eyeball has a lot of small blood vessels, and you had mentioned diabetic retinopathy as being one of the things that you've struggled with. And just to let everyone out there know, what can happen in the eye, and the reason it's so important for diabetics to get their eyes checked, is because when we look inside the eye, we can see all those little blood vessels inside the eye, and we can tell a lot about a patient's diabetes by what their blood vessels look like. And if the diabetes possibly isn't under control, those little blood vessels will leak blood and fluid and can possibly lead to loss of vision or vision changes, things like that. And on one of our previous shows, Dr. Bellinger made the great point that by looking in the eye, we can look at a nerve, we can look at blood vessels and all sorts of tissues without actually having to cut the patient open. So we can see living, breathing blood vessels in its natural state, and it can tell us a lot about the body. And Jack, you had mentioned laser treatment. So back then, how old were you when the diabetes started to affect the eyes? Do you remember?
I was, you're making me do math, like right on the shot here. About 20 years old.
Well, 20 years old, yes, that's pretty young. Pretty young.
I was very young, I was very scared. I was actually, my sight was 2200 and 2400.
which is not legal to drive.
No, it's not even really legal to see. So
Right.
it was a hard time in my life.
So how was it affecting you back then when you were 20 years old?
How was it affecting me?
Yeah.
Well, I actually went out and bought a German Shepherd. I had to change my life. I had to quit my job. Life changed. Life totally changed. Like I said, it was all new back then. Sure. From what I understand, 2 or 3 years earlier, I would have just went blind. So the lasers helped me out tremendously, and they didn't know where I was going to be in 10 years. Right. But luckily, everything worked out. Started to watch my sugars a little more, started to behave, and that did help, but it did put a damper on my life right up till today. I still struggle with it.
Yeah. And laser treatment back then is a little different even than laser treatment now. Laser treatment back then, the goal of the laser treatment was to basically kill the retina and the blood vessels that were leaking, and to stop that, because the more and more those blood vessels leak, fluid and blood, the worse our vision gets. So by killing that tissue and stopping those blood vessels from leaking, we would kind of slow down the vision loss. The problem is sometimes with doing that laser is it wouldn't really make the patient's vision better. In some cases, it actually may make the patient's vision worse. So you were darned if you do, you were darned if you don't. So you had the laser treatment. You also mentioned something called a vitrectomy, which is not a fun surgery to go through,
no,
as you know. The vitrectomy is a condition, or I should say a surgery, where if you get leakage of blood into the jelly inside the eye called the vitreous, that also can make vision very blurry. So in a nutshell, we have to go in and remove the jelly inside the eye and put in a fake jelly in some cases. And that's a surgery that can be uncomfortable. The healing process, you sometimes have to keep your head in a certain position. Did they make you put your head face down for a certain number of hours? Do you remember?
They did, and I had to lay, if I remember correctly, I had to lay flat for at least 24 hours after the surgery. It was very, very uncomfortable.
Yeah, that was back then. That's kind of what we had to do. It's not as bad now, but still that head down position is important for the healing process with the vitrectomy. So you went through the vitrectomy, and then there's other procedure. They actually take a cold probe, and you had mentioned cryo, right, where they actually freeze the retina to prevent it from actually getting a retinal detachment. So you were through a lot with your eyes in those early years, and as we help the retina in those cases, part of the problem is, especially in young patients, it can cause a patient to develop cataracts. And I know that's something that you ended up developing were the cataracts. So what I want to do is we're going to take a quick break here. Actually, that was a quick 8 minutes already. And when we come back on the next side of the break, we're going to talk about your cataracts and how that affected your eyes. So we're going to take a quick commercial break here. When we come back, we're going to talk to Jack a little bit more. And you're watching Eyecare Today. We'll see you in a minute. Welcome back, everybody. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Tannersville location, Stroudsburg Eye Specialists, located on Route 611 in the beautiful Poconos in Tannersville, Pennsylvania. Our phone number, 570-421-3342. Our Hazleton location, if you're watching us from the Hazleton area, is Hazleton Eye Specialists, 453-2020. And our website, www.drkislan.com. Download the SSP TV app, watch our show, none of the other shows on there. Make sure you watch our show, Eyecare Today, on the app, and you can learn about all the great things we talk about on the show and learn a lot about different eye conditions. Today, we're joined by a patient of ours in our Stroudsburg location, Jack. Jack's been our patient for about 6 years now. And Jack's been through a lot with his eyes. Specifically, diabetes is one of the conditions that's he's been struggling with and has caused a lot of eye issues that we were talking about. And Jack, before the break, we were talking about the retina problems and the surgeries that you ended up having to try to preserve your vision. And in that course, you can actually develop cataracts at a young age. So do you remember how old you were when you developed cataracts?
I developed cataracts in 2009.
2009. So they then start to impact your vision. So then you ended up having to get the cataracts removed.
Yes.
And how did that improve improve your vision?
It improved it a lot. You know, at one point I couldn't see out of my right eye. That's when my previous doctors decided that it's time to do the cataracts. They wanted to wait till that time. They didn't want to react on it right away. When I did go through it, the surgery was fine. I mean, it's a very in and out type of surgery, very quick. Unfortunately, I came out of the surgery with my last eye, and I was looking at a cardboard box that my grandkids have sent me, and I put it right into my eye the day after. Put me down for a year. I believe you also were involved in I had a scratched cornea, and whatever, we went through that. You did your magic on that and whatever. But it was I mean, it's a hard thing to go through, cataracts. It's and sight-wise.
Yeah, as you develop them, and then it affects your vision, and like you said, the surgery now is a lot better even than it was back then.
Right.
And I want to touch a little bit on kind of what you said about that injury, because that's something that happened way back, but then it still kind of affected you in the last couple years. And there's actually a condition called recurrent corneal erosion. So diabetics in general don't heal as well as everybody else. And when you have a scratch on the front of the eye, the tissues have to, normally they heal really pretty well. The tissues have to heal up to not only prevent blurry vision, but to prevent pain. And if the tissues don't heal very well, you can get these kind of ongoing, patients can just wake up one day and all of a sudden they're in pain, they can't see, and they're like, what the heck happened?
Right.
And that's kind of, if I remember what happened with you, you woke up and like, what the heck's going on here? And I think that's what brought you into our office one of the first times, was I've got this kind of painful eye that I can't see out of. And after talking, we figured out that it was from an earlier injury. So this recurrent erosion, years ago, we used to put a patch on the eye, where we would just put a patch and tape the eye up and keep that closed. And nowadays, I think if you remember, we put a bandage, we call it a bandage contact lens.
Correct.
On the eye. And very kind of interesting now doing that. We think of contact lenses as these things that young people use to see better, and sometimes it is, but also we can use them as a Band-Aid.
Right.
So if you think of your eye and having a scratch on the eye, every time you're blinking, you're rubbing over that area that's irritated and swollen and red. If it's on our skin, we can put a Band-Aid on. You can't put a Band-Aid on the eye,
Right.
so we use a clear Band-Aid, this contact lens, and inside that contact lens is a medicine. It's actually called an amniotic tissue that helps promote healing. So you remember, took a couple days for that to get better, but I think you did pretty good, if I remember. It healed pretty fast. And I think you had another recurrence, if I remember. And these things can come and go. But you've done pretty well with that. I don't think we've had one of those for a while.
Yeah, been a couple years now, so.
Yeah, and part of that is diabetics also can get some dry eye issues. And I know we've talked about that in the past. And if we kind of help that dry eye, that keeps the cornea more lubricated, which helps to prevent those little scratches. So what are we doing now for the dry eye? I think
we're doing Restasis, and we're doing this new vitamin, the omega-3s that I'm actually on. So
yeah,
and it's working.
Yeah, the folks out there that are watching, they've heard us talk about Restasis before. Restasis is one of the prescription medications out there that's actually approved for dry eye disease. It's 1 drop twice a day that helps to reduce inflammation in the eye, which is one of the things that causes dry eye to progress. And omega-3s, patients have heard me talk about omega-3s in the past. They're also anti-inflammatory. They work from the inside to reduce inflammation, again, which is one of the leading drivers of making dry eye worse. And also we've done, if you remember, some plugs.
Yes.
Remember us doing
I do.
tear plugs? So plugs are, if you think of your eye as your kitchen sink, water comes out the spigot, goes into the sink, out the drain, and out the pipes. Your eyes are kind of the same way. Our eyes produce tears. They're made and then they drain out. And if we want to keep fluid on the surface of the eye, we can put these tiny little microscopic, they're called plugs, in the tear ducts, and they're about half the size of a sesame seed. Do you remember that hurt at all, having them put in?
It didn't hurt. I wasn't uncomfortable as they're in. No, not at all. I just remember my eyes teared. You know, it's like I was crying a little there, but no, it actually helped.
And between the Restasis, the plugs, and the omega-3s, that dry eye's been holding up holding up pretty
No,
well.
definitely. It doesn't feel like there's sand in my eyes anymore. So
No sandy, no gritty,
No
no
go,
picky,
boy.
any of that stuff. So as far as the diabetes goes in the eye, your retinopathy has been pretty stable
Yes.
over the last couple years. It really hasn't progressed. We've been watching that
Oh, boy.
pretty regularly and looking at the retina and the blood vessels. So we've been lucky to that point. Unfortunately, the one other thing diabetics can sometimes develop as the years go on is something called glaucoma. Now, you were first diagnosed with glaucoma when? Do you remember?
I want to say it was around 2010.
Okay. And glaucoma is a condition where the pressure in the eye can go up, and that pressure can actually damage what we call the nerve in the back of the eye. So the retina, which is damaged from diabetes, is the tissue that actually takes the signal that we see and processes it and then gives it to the optic nerve, and that optic nerve sends the message to the brain and allows us to see. So we're already having damage to the tissues from the diabetes. The last thing we want is damage to that optic nerve that is what sends the message to the brain, and that's what glaucoma can do. So you were diagnosed with glaucoma, and what we'll do is on the next side of the break, we'll talk about your glaucoma and how we're doing with that. So we're going to take a quick break here. And again, you're watching Eyecare Today, and we'll see you in a minute. Welcome back, everybody. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we're coming to you from our Tannersville location on Route 611 in Tannersville, Stroudsburg Eye Specialists. Our phone number is 570-421-3342. Remember our Hazleton location, located on the Airport Beltway in Hazleton, Hazleton Eye Specialists, 453-2020. Our website, www.drkislan.com. You can actually get us on Facebook also. And remember to download the SSP TV app, and you can catch any of our shows on there. They're all archived there. You can see us talking about many conditions, glaucoma, macular degeneration, diabetes, headaches, melanoma, all sorts of different topics that we talk about and discuss. Our last two segments, we were talking to Jack, one of our patients from Stroudsburg office, and Jack was kind enough to come in and share his eye history, long history of some diabetes and some surgeries he's had, and we talked about the cataracts that he had to have removed, and then we were just starting to touch on before the break, Jack, about glaucoma. So you went through all these different things, the diabetes, the cataract surgery, and then this was, I think, before we started seeing you that you were diagnosed with glaucoma, but what was your thought when you heard, now I have glaucoma?
I thought I was about 70 years old because I always thought it was just in older people, and that's not true.
Exactly. And that's the thing, diabetes affects multiple systems in the body. The eye obviously is one, but diabetics are a little bit more prone, especially in the younger years, to developing glaucoma. And glaucoma is a condition where the pressure in the eye can go up, and that elevated eye pressure pushes on the optic nerve, causes damage to that nerve, and can cause us to lose our peripheral vision in the beginning, but then our central vision as time goes on. So two things we really don't want together is central vision loss from diabetes and then peripheral vision loss from glaucoma. So you've been on multiple eye drops for the glaucoma, correct? And if I remember your history, your pressures would do good, and then they would start to rise again, and things would have to be changed.
Correct.
How are we doing now?
We're doing good. We're getting better. We're actually working on a new medicine that you put me on, a new drop. So we'll see in a couple weeks when I come back in how my pressure is if I pass the test. But it's nothing I could really feel. I couldn't feel the pressure. I didn't notice the pressure. And as for the peripheral, I've had a problem with peripheral because of all the lasers I've had.
Exactly.
So
yeah,
I didn't want that to get worse.
Exactly. And you know, that's a great point you make. Glaucoma is a condition that you don't feel. It's not a pain that you get. They call it the thief in the night because you can wake up and your vision's lost from the glaucoma. So it's important that that's something not just in diabetics, but every patient that comes in, we check their eye pressure and make sure that's okay. There's many different medications we use to treat eye pressure. In your case, it's been eye drops. There's been different ones you've been on over the years, and you mentioned there's a new one that you're on. It's called Rocklatan. So Rocklatan is a brand new class of drug that's actually out. It's actually a combination of a medication that's been out for a while, a drug called latanoprost, and a brand new class of drug called Ropressa. It's what we call a ROCK inhibitor, and all that means is there's a chemical in the eye called Rho kinase, which elevated levels of Rho kinase cause inflammation and cause actually glaucoma to get worse. So this is called a Rho kinase inhibitor. And it's a brand new class of medication. And when this Rho kinase inhibitor along with latanoprost are put together, we've actually seen great results as far as lowering the eye pressure. And the nice thing is it's 2-in-1. So it makes patients' lives a little bit easier, so they're not having to do another 2 drops. They just have to do another 1 drop, because it can probably get, pretty frustrating throughout the day having to be putting drops in all the time.
Sure.
Because you're doing a drop called Timolol
Right.
in the morning, plus your Restasis twice a day.
Correct.
Plus your omega-3s.
Correct.
And then we throw on these drops at night. So it's a lot to remember to do.
It is a lot to remember to do, especially since I give it some time between drops. I don't just do these 2 drops at once. I give it 15 minutes in between. And
Yeah. Is that tough as a patient to remember and get into that schedule of doing all that?
not for me now, because this is my life. I've lived this. I eat it. I drink it. So this is what I'm used to. I know the routine, but I'm sure for some people it could be.
It's interesting that you say that, because one of the things we struggle with as doctors, especially with some of our senior patients, is what we call compliance with their medications, specifically their drops, because it's important to get them in at the prescribed times, but we get busy in our daily lives, we forget, and missing eye drops actually can cause problems with the eye pressure, and the condition can get worse. So it's important that patients out there remember to do their drops. There's many ways to remember, writing down a schedule. We now have alerts on our phones we can do, all these different ways to do it. But like you said, you've been eating it, drinking it all these years. You're kind of in that routine right now. So let me ask you, since you've come to our office, and this is a time now that I'm going to probably gloat a little bit.
That's okay.
How have you found the care to be?
The care is awesome. I mean, I come here, I believe, every 4 months, which is very important, because I do not want anything to progress. Right now, all's we can do is we can maintain. It's not going to get better, but we can maintain it from getting worse. But the care has been great. Dr. Kislan, you've been right on it. I mean, you really have. So, no, it's been great. It's a great experience.
I appreciate that. I think one of the things we pride ourselves on is we have all the latest technology.
Yes, you do.
Patients always say when they come in, well, what's that new thing you have? And technology is advancing so fast that it's important to keep up on it, because if we can find a change in someone like you who has had some vision loss, and again, the key is to not lose any more, and we can find that change before it impacts your vision in your life, that's all the better. And again, new medications that come out, again, we do research here, so we pride ourselves on probably getting some of these things sooner than some other practices may. We were one of the first ones to actually have Rocklatan
Right.
in the area. I was able to get that to you. It actually wasn't even available in the pharmacies, I think, yet when I got you the samples. So, like you said, next time you come in, we'll see how you're doing on the Rocklatan. Have you had any side effects from it?
No, I haven't. I know the pressures have gone down on our first round when we started it. So
Yeah.
Something's working there.
Good. And glaucoma can be frustrating, because it's one of those conditions that we can stabilize for a while, and then eventually the pressure can creep up again, and we have to change gears. We have to do something different, find that maybe cocktail that works for you that may not work for somebody else. And sometimes that can be challenging, but I feel we're up to that challenge. Anything hints you can maybe give the folks out there watching as far as the importance of kind of just getting their eyes checked?
Well, the one thing I could say, if you are a diabetic, whether you're type 1 or type 2, watch your A1Cs, watch your sugars. I mean, it's very, very important. It's amazing what it does to the blood vessels in your body. And once it goes, it's a ride, and you don't want that ride. But as for your eyes, get your eyes checked. It's very important to make your appointments. It's very important to do your medications. It's going to maintain it from getting worse.
And that's one of the things we try to stress to patients is, for me, it's frustrating as an eye doctor to see vision lost when we know there's something we can do about it. And when patients aren't compliant with their sugars, and it's tough in the weather's getting nice now, we're at cookouts, we like to have a hamburger with a bun and maybe some ice cream, and it shoots those sugars up. It's very difficult to do. So, patients like you who take it seriously, I commend you, because it's a very, very difficult thing to do. We reviewed a lot today, folks. We talked about Jack's retinopathy, about his diabetes. We talked about his cataracts at a young age. We talked about glaucoma. And I think the thing we're trying to stress is to really, take care of your eyes. They are so important, and these conditions can really affect the eyes. So again, Jack, I appreciate you coming in. I thank you for trusting us with your eye care. Hopefully we gave the folks some tidbits here as far as what can help them. So everyone, thanks for watching. You watched another great edition of Eye Care today, and we'll see you next time.